Hi everyone, welcome back to my YouTube channel, and today we are going to talk about sphenoidal sinus anatomy. So let's start our topic with introduction. Sphenoidal sinuses are paired paranasal sinuses that are located within the body of sphenoid bone, deep in the skull behind the nasal cavity. They are closely related to important neurovascular structures, making them clinically significant. The sphenoidal sinuses are separated by a thin septum and open into nasal cavity through sphenoethmoidal recess. Location and shape of sphenoidal sinuses. They are situated within the body of sphenoid bone, posterior to superior nasal concha and nasal cavity. They are paired sinuses that are separated by an irregular intersinus septum. Their shape is irregular cavity that may be asymmetrical, and their size increase with age. Boundaries and relation of sphenoid sinuses. Sphenoidal sinuses is surrounded by vital structures. Superiorly, there is presence of tersica and pituitary gland and optic chiasma. Inferiorly, there is roof of nasopharynx. Anteriorly to the sphenoidal sinuses, there are posterior nasal cavity and sphenoethmoidal recess, and posteriorly there is clevis and pons. Laterally to it is cavernous sinus, internal carotid artery, and cranial nerves number 3, 4, 6, and ophthalmic division of trigeminal nerve and maxillary division of trigeminal nerve. Openings and drainage of sphenoidal sinuses. Each sphenoidal sinus drains into sphenoethmoidal recess that is located above the superior nasal concha. Drainage is often gravity assisted due to the high location of the opening. Size and development of sphenoid sinuses. They are absent on or very small at the birth, and they begin to lodge at the age of around 3. They fully develop in adolescence, reaching maximum size in adulthood. Their average adult size is 7 to 8 milliliter. Blood supply of sphenoidal sinuses. First, we will talk about arterial supply. It is supplied by posterior ethmoidal artery, that is branch of ophthalmic artery. And also it is supplied by branches of sphenopalatine and pharyngeal artery, that are branches of maxillary artery. Talking about venous drainage, it drains into posterior ethmoidal vein, pterygoid venous plexus, and cavernous sinus connections. Now supply of sphenoidal sinuses. First we will talk about its sensory innervation. It is supplied by posterior ethmoidal nerve, that is branch of nasociliary nerve, that is the branch of ophthalmic division of trigeminal nerve. It is also supplied by orbital branches of maxillary nerve, that is branch of trigeminal nerve. Then we will talk about its autonomic innervation. It is supplied by parasympathetic fibers from facial nerves through pterygopalatine ganglion, and it is supplied by sympathetic fibers from the superior cervical ganglion. Lymphatic drainage of sphenoidal sinuses. It drains into retropharyngeal lymph nodes, then to deep cervical lymph nodes. Functions of sphenoidal sinuses. First, it lightens the weight of skull. Second, it contributes to the resonance of voice. Third, it produces mucus to moisten the nasal cavity. Fourth, it provides surgical access to pituitary gland, that is also called as transsphenoidal route. Clinical significance of sphenoidal sinus. First, sphenoid sinusitis that can cause deep-seated headaches, and infection may spread to cavernous sinus or cranial cavity due to proximity of the location. Second significance is pituitary surgery, as sphenoidal sinus provide a surgical corridor for transsphenoidal hypophysectomy. Third significance is orbital and cranial complications, as it is closely related to optic nerve and cavernous sinus that make infection potentially dangerous. Fourth significance is trauma, as feature involving the sphenoidal sinus may lead to cerebrospinal fluid rhinorrhea. Conclusion of this lecture video. Sphenoidal sinus is a deep, centrally located paranasal sinus that has a great surgical and clinical relevance because of its proximity to the pituitary gland, optic chiasma, and cavernous sinus. A solid understanding of its anatomy is crucial for safe surgical intervention and effective treatment of sinus infection. And this was all about sphenoidal sinuses. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.